So why don't we get started? First, I just want to thank you for inviting me. I'm Mike Redington. I'm with USDOT out of the Volpe Center in Cambridge, Massachusetts. Although I'm currently at home in Andover, Massachusetts. So I'm not with FTA, but I've been working on the FTA drug and alcohol program since 1996, I believe. So I've been an auditor. I review and validate most of the MIS data that comes in, newsletter articles, things like that. So I've been working on the program quite a long time. I've been an auditor for 21 years, have been to every state in the country with this program providing audits. So what we're going to look at today is just kind of what's going on with FTA drug and alcohol. So kind of a program update, not really have the time frame to do a training on rules and regulations or compliance at this point in time. But we're going to just say, kind of let you know what's going on with drug and alcohol. From what I understand, you can ask questions and during it, and that's fine. I'll take any kind of questions that goes on. So there's my contact information. So if you have questions following this or anytime, in the foreseeable future, give me a call, send an email. FTA prides itself in this program of providing technical assistance. So there it is. And I'll be providing some other contact information for myself and other individuals at the end of the presentation also. But, we take a lot of calls. We try to provide a lot of technical assistance. So it's pretty much constant, but it's something that we want, and it's a service that we certainly want to provide to you. So if anything comes up, give a call. If you think, did I handle a situation correctly? What's the best practice? Do you have, where's a form I could use? Are there any trainings? Anything like that, give a call, send an email, and we're certainly happy to deal with that issue. So what we're going to take a look at is just some of the things going on with FTA and DOT, and there have been a few changes recently, so we're going to go over those. We're going to talk about audits and a little bit about the FMCSA clearinghouse and a few other things. So that's the general agenda we're going to be going through. And so the first thing we're going to talk about as far as revisions with the drug and alcohol program, this comes from the DOT side, is that there's now a new federal drug testing custody and control form. It must be used beginning August 30th, 2021. So you should all be using it. Whether you provide the form or the collection site does, you should ensure that you have the new form. Okay. It's required. So you should at this point in time have kind of gotten rid of all the old forms and only being used this new form. It is required as of August 30th, 2021. So that means all the labs, medical review officers, collectors and such must be using the new form, okay? And the revisions on it were for a couple of reasons, but the main reason was for it to accommodate oral fluid testing. And so we're going to talk about oral fluid testing in just a minute, okay? So this was the first step in preparing for DOT to begin to utilize oral fluid testing for drug testing along with urine specimen collections. Now, if you still are using the old form for whatever reason, maybe you were unable to get a supply of the new forms, maybe you just kind of forgot about it. Whatever the reason, if you're using the old form, you must complete a memorandum for the record. If you do not, the test will be canceled. And so we're going to go over what exactly is a memorandum for the record in just a second. But just remember, there's a new drug testing form out there. You need to have already begun using it. You should have started using it already. And you should ensure that your collection sites have the new form and that they're using the new form. Because again, you don't want to have your tests canceled. Now, the new custody control form, as we stated, the main purpose of it was to begin kind of noting that oral fluid is being used as the test type. However, there are other things in there also. So in step one, added in the CDL state and number also on the new form, and that's being put in there only if you're covered by Federal Motor Carrier Safety Administration, because that's all part of the FMCSA clearinghouse, which we'll go over a little bit in just a few slides from now. So that's one of the additions to the form. The other addition to the form is that they put an other category under the collector contact information. And that's most likely, though, to include an email address. Okay. And then there's the oral fluid box. Now, you should ensure that no one is using oral fluid testing at this point in time. It is not approved for DOT at this point in time. This is in preparation for when oral fluid does get approved by DOT. But currently, the box is there. However, it's not allowable for a DOT test at this point in time. It is allowable for federal tests, but not for DOT tests at this point in time. So do not do any oral fluid testing. And again, we're going to go over oral fluids in just another minute or so. One of the other changes on the form is that they've included an email address for the donor. Although it's a very short line, I'm not sure who could fit the email address in there. However, that is another change in the form. Okay, so the form was, as I said, the primary purpose of the new form was to include oral fluids. It was also because the old form has kind of a shelf life with OMB. And once it runs out, you have to either re-up the form or you have to submit another form. So they decided to submit another form, which included oral fluid. Another thing is that the instructions for completing the CCF on the back of copy 5 were removed. Those instructions are still available on the two following websites right there. So from Hampshire and from ODAPSI, we'll have those instructions on their websites. So there's the new form. There's the changes in the new form. And again, just ensure that you're using the new form, your collection site is using the new form. So we said that if you did not use the new form, you needed to include a memorandum for the record. Okay, so what exactly is in a memorandum for the record, MFR? So it includes a statement that the incorrect form was used, but that the incorrect form contains the required information. It's that the incorrect form was used inadvertently or as only means. So in other words, the new form wasn't available and you only had the old form. So you have to put a reason why you use the old form. And the steps taken to prevent the use of the old form forever. You will never use that old form again. Make a statement that we will not use that old form, and here are the steps to ensure that we will only use the new form. Now, in order for it to, for the memorandum for the record to kind of suffice so that the test is not canceled, the test had to have been done as a DOT test. So the specimen must have been sent to an HHS lab, had to have been a split specimen and processed as a DOT test. Okay, so if one of those things didn't occur, it cannot be considered a DOT test anyways. And remember, if there's no memorandum for the record, the test is canceled. Okay, so just ensure you're using the new form. It came out, the directions and timeframes and stuff have been out there for over a year, so there's been plenty of advance warning on this. But again, as of August 30th, the new form must be used. So we said we're going to talk a little bit about oral fluid testing. And what's happening is that eventually oral fluid drug testing will, well, urine specimen testing will not be the only type of testing for drugs. The oral fluid will be the second type of allowable test. So Health and Human Services submitted this rule to allow permissible methodology for federal employees drug testing. In other words, they said the results had the same confidence levels as urine tests. So in other words, they were confident that 99.9% of all tests will be valid and will be correct. So HHS determined that this was a valid type of testing for federal tests. Now, the Omnibus Transportation Employee Testing Act always says that DOT will follow HHS. So once HHS said this, DOT were required to go along with oral fluid testing, though it's something they've been working on for years anyway, the two organizations. So it's something they wanted to move forward through. So as it says, HHS determined that oral fluid testing provides the same scientific and supportability of drug test results as the federal drug testing using urine. So in other words, there is no difference in the validity of the test result between urine and oral fluid. Okay, so oral fluid will, along with urine, be now the two types of allowable federal tests for DOT going forward. However, it's currently on hold. Okay, and the reason it's on hold is because though HHS came through and said it's a valid test method, anyone who's ever read Part 40 or anyone who's ever gone to had a urine specimen collection test done, a DOT federal test done, or has seen one, knows that there's a very specific process. So although HHS said that, yes, you can do oral fluid testing, it's just as valid as a urine specimen testing, DOT still had to develop its own testing process and regulation. So in other words, if you read Part 40, and it's very specific as to the order of the steps and the steps that must be taken for a urine specimen collection, they will be the same for oral fluid testing. So they're going to come out with an addendum to the regulation, a new rule actually, that will also define just as specifically the steps for how an oral fluid test is conducted. And DOT, there were a couple of issues with the DOT they had with HHS, was that DOT said, well, we do a split specimen. And that's in our regulation, and we're going to keep that even for oral fluid testing. So HHS had not determined how to do a split specimen, given the fact that oral fluid testing is done with swabs. So DOT had to come up with a process. So that is something that's happened recently. So they've satisfied that requirement for it to be a split specimen. Also, the DOT had concerns that the test was only for use. In other words, DOT, when you do a federal urine test, is not trying to determine if you're impaired. They're not trying to determine if you're exposed. They want to know have you used drugs, the illegal drugs. So in other words, they're not looking for impairment, because in all honesty, most people who test positive for a DOT drug test are not impaired at that time. However, they show indications that through the urine specimen that they have used illegal drugs. So there was concerns that because oral fluid testing with a swab inside the mouth does pick up exposure. So we've all heard the people who have an excuse for why they tested positive for a urine test. And they'll say, well, I was at a party, I wasn't smoking, but the other 25 people in the room were, and there was so much smoke that it must have soaked into me, and therefore I tested positive. Well, that can't happen with urine specimens. However, there was some concern that could happen with oral, and that your gums could actually absorb secondhand smoke. So there was some additional research done, some additional testing. It's been satisfied as far as DOT goes. And so now they're kind of ready to go forward with it. However, it's still has not been authorized at this point in time for a DOT drug test. So oral fluid is on hold for DOT testing. However, expect some news on that fairly shortly. Because what's happened with oral fluid testing is recently they have written a notice of proposed rulemaking. So that addresses some of the issues that we just talked about. What is the process for oral fluid? How do you ensure a split specimen? Things like that. So it really defines this notice for proposed rulemaking really defines the new oral fluid testing process that will be allowed by DOT, which will be supported by DOT. So what this notice for proposed rulemaking, and I've seen a draft version of it. Currently it's in draft version. It's being reviewed by all the modal administrators, or the drug and alcohol program managers for the various modes, for instance, for FTAs, ION, Rosario. And when they're satisfied and when they've received all their comments, they will forward it to the Office of the Secretary for a review at that point in time. At that point in time, if the Office of the Secretary will have comments and such, At some point in time, they'll come up with the final version and it will go for rulemaking at that point in time. So there is still some process left in place, and there still is some time until this happens, because right now they have a draft notice for proposed rulemaking. Now it does include, like I said, all the issues concerning oral fluid testing. However, it will also include other issues. So in other words, they typically use the notice of proposed rulemaking to address things in the current Part 40, which, let's say, were not stated clearly. So maybe they use, maybe they revise some wording to ensure that it's a little more clear, certain things. Over the years, they've seen that maybe there's some, basically to fix some mistakes that they found over the years. So they'll use this for that purpose, and also for some other purposes too. And I can't get into it because it's just proposed at this point in time. It may not make it to the Office of the Secretary, and even at the Office of the Secretary, they may not also allow this in the rule. But there may be some things concerning the ability of DOT to add to the testing panel, just as they did with opioids a few years ago. But that's a long process, and there may be something in there concerning alleviating the process to make it easier to add certain drugs to the testing panel. But we'll see what comes out with the proposed rulemaking. When it does come out, it'll be out for 60 days. That's considered the comment period. If anyone here wants to comment it, you certainly are. It'll be out there for you to review. And typically what happens is they get comments from people like Quest Diagnostics, LabCorp, maybe some employee unions and things like that. Those are typically where the comments come through. But what this rulemaking will do, it will revise 49 CFR Part 40. And what they consider, and one of the things they have to do is detail what the benefits of this are. So what are the benefits of oral fluid testing? Urine testing has worked well for a good number of years, 25, 26 years at this point in time. But one of the things they've determined is that it will help combat cheating on urine drug tests. Essentially, every drug test will be an observed test. So in other words, there will not be all the security requirements or privacy enclosure and all that type of thing. There will be someone who will be conducting the test, and you will take the swab and swab your mouth in front of them. So it's going to help with adulteration, substitution, things like that. So it will help with combat cheating on urine drug tests. Provide economical, less intrusive method. So it will still be a lab test. In other words, you'll take the swab, and most likely there will be, because it's split specimen, I'm not sure how they're going to handle it, but it's going to be 2 swabs. Those swabs will go to a lab. The lab will run them through, just as they do with urine, to detect drugs based on the levels of the drugs. So it will be, they're thinking in the long run, this will be much more economical. It'll be cheaper to conduct the test, but certainly much cheaper, not only from the lab side, but on the collection side also. You won't need the facility, basically. You'll be able to do an oral fluid test basically anywhere. So there's not all the privacy enclosures, the building security issues and such. Less intrusive, certainly someone, rather than doing a direct observation with providing a urine specimen with the same gender and all that type of thing, this will be this will just be in certainly less intrusive as far as it's just putting a swab across your gums and such. So it's considered, they're considering this to be a major change in the testing process. And it'll be interesting to see once it is approved, the impact it has on testing and on test results. I've heard some people say that they think this is going to result in a lot more testing because it's going to be much easier to do, and in the long run will be much less expensive to do. So we'll see how that goes. But DOT, it has been for years looking for an alternative method to urine specimen collections. They've at one point in time, they were looking at hair testing and things, and that they never met the scientific requirements, the confidence levels that they require. So that's what's going on with oral fluid. There's a notice for proposed rulemaking should be hitting the streets, I would think, within a month or two, but I'm not really sure about that. And then at that point in time, there's a 60-day period. And as I said, it will also this rulemaking will also clarify some of the Part 40 provisions. So ODAPSI, which is the organization, Office of Drug and Alcohol Policy Compliance, has maintained a list over the years of things where there's been some common misconceptions, maybe things that weren't worded well and such. And so they're going to be kind of fixing or rewriting certain things in the regulation, and also addressing other issues. They may address some of the electronic record keeping issues and such, because when they originally wrote this regulation, there was not a lot of electronic records at the time. But there are some other issues in there that they will be addressing also. So it will be interesting to read. I would suggest that when it comes out that you read it, and if you wish to comment, go right ahead. So one of the things that people have noticed is that they don't see the auditors coming around anymore. And the reason is because we are not doing on-site audits at this point in time. In fact, we were not doing audits for a good, I think it was somewhere around 8 or 9 months. There was a combination of waiting to see if we could go back online, go back on the road, and also determining a process by which we could do it virtually. So on January 25th, 2021, we began the virtual audit process. And as of it stands right now, we don't have any indication or any date as to when we may go back to in-person audits. So virtual audits are kind of how it's going to be happening for the foreseeable future. When I say foreseeable future, I'm probably talking, I don't think we'll hear anything for another few months on this. Okay, so even once we get to the point where they allow us to go on site, it will not be for at least 7 weeks after that, because we require a 7-week notice. So audits basically work the same way as they always did. A notification to the grantee, a phone call from the team leader, who's usually an FTA contractor, and an email, a follow-up email, detailing, informing you, notifying you that we're going to be going on it, that we're coming there for an audit, or we're going to be doing a virtual audit, and following that up with a letter from the Rosario, the FTA's program manager. And then following with other information for request of information, records and such. So as in past where we would come on site and look at records, we're now requiring that you scan records and submit them on Huddle, which is kind of a record keeping management type tool. And then we're doing interviews through Teams, and all the standard interviews that we've always done. As far as the creation of the report and such, it basically works the same way, in that we on site will create a drug and alcohol final report, and that we will present it to you on Friday of the week of the audit. And then you then have 90 days in which to respond to those audit findings. One question we always get is, well, and now that we've had an audit, does that mean we don't have another audit for 4 years, 5 years, 6 years? We're not like triennial review. We do not have a regular cycle. So in other words, we've had some FTA covered employers out there who've gone through 5, 6, 7 audits. We've had others that had 1 or 2 audits. We use a number of factors in determining our audit schedule. A lot of times it has to do with the size of the transit system. There's information we looked at. So we look at your MIS data, we look at your NTD data. We know if you've had a revision with your drug and alcohol program manager and a new person. It's just many different factors going to it. So there is no regular cycle. There is actually no schedule going forward past the end of this month at this point in time. And the reason is because the FTA audit contractor, Cahill Swift, their contract is up. So we're currently in the procurement process for an audit contractor. So we won't schedule until the contractor is named at that point in time. And it may be Cahill Swift, it may be someone else, but it's just started at this point in time. So audits are going on, but again, they're virtual. And again, it's about the same, about 2 a month or about every other week, something like that is typically how we do them. And again, we're only doing audits. We only have a schedule out to October, end of this month at this point in time. So I don't see us probably starting audits again until the 1st of January. And we'll see, we're still awaiting word as to when we may go back on site and conduct in-person audits. So one of the things that FTA has just has provided some guidance on that may affect some people is that's 5310 funding of recipients and sub-recipients. So trying to clarify, because there's a lot of different language out there concerning 5310 funding and whether or not, if you receive 5310 funding, are you required to have an FTA drug and alcohol program? And if you go back to the very earliest interpretations, going back to 1995, 96, 97, and some of the various newsletter articles, there's really been an inconsistency with FTA's determination on this. So FTA is trying to kind of be a little more clear on this. There will be a frequently asked questions concerning FTA funding coming out within the next few weeks. We've been meeting on this in the last couple of weeks. So 53 employees are covered when the employer also receives other type of FTA funding. They are not covered when the employer does not receive other types of FTA funding. So they try to clarify and just keep it pretty simple. That's it. So if you're an employer, you get 5311 funding, you also get 5310 funding. Those employees who are covered by 5310 funding who do that basically elderly and disabled service, they're also required to have an FTA drug and alcohol compliant program. Okay, so that's something that will come out officially in the next few weeks. There's going to be a frequently asked questions, which is basically just going to state this matter. Okay. One of the things, and I kind of stuck this slide in at the end because we've been giving several questions about this, and it seems to come in kind of like in spurts about this issue of CBD. It's like, if I take CBD, will I test positive on the DOT tests? Okay, so back in 2020, ODAPC, the Office of Drug and Alcohol Policy and Compliance, did provide some guidance on this. Okay, and just to let you know that DOT does not test for CBD. So when the specimen goes to the lab, no one is running this for CBD. No one is trying to determine if CBD is in the urine specimen. Okay, it's not part of the DOT 5-panel test. You will not test positive for CBD. However, DOT does test for THC, as we all know. And THC is a scheduled drug, Schedule 1 drug. So if using CBD, since it comes from the same plant, the test detects THC, then you will be positive for THC. Now, you may not think that you're taking THC. You may just be saying, well, I'm just taking CBD. I wasn't aware that THC was in the CBD product that I was taking. That's too bad. DOT requires that you be responsible for what you put in your body. So there's no legitimate reason for a marijuana or a THC positive, okay, to have in your body. So if you take CBD, and even though the package says it does not contain THC, the CBD is not regulated by anyone. So there's a lot of places out there that are not legitimate that put no THC on the package of the product. And you know what? It does have THC. And we have seen situations with people who will swear they only take CBD, but you know what? They've tested positive for THC. So it is a DOT positive test at that point in time. So all we're saying is be careful, okay? And the excuse that, oh, I don't take THC, it's CBD, and I can show you the CBD product, it doesn't matter. You have THC in your system, you tested positive for THC. All right, the minimum required random drug testing rate. So the testing rate currently is at 50% for 2021. Just to let you know, for 2022, it will also be at 50%. So there's not going to be any change in the drug testing rate or the alcohol testing rate. It will remain at 50% for drug, 10% for alcohol. And there'll be a federal register notice coming out shortly stating that. So that covers all your FTA covered employers, whether it be grantees, contractors, subrecipients, whoever. So 50% is staying as the minimum random drug testing rate. Now, of course, if you want to test higher than 50%, go right ahead. FTA is fine with that. You don't need to have it in your policy or anything like that. Just if you want to test higher than 50%, go ahead. We was doing an audit last week where someone was testing at 75, 80%. That's okay if you wish to do that. It's a minimum requirement. So it will stay for 2022 at 50%. And just to let you know, it's almost up to MIS season. So the notification letters will be sent out late December. They're sent out by regular mail, postal service. The letters which notify you to submit your annual MIS information will go out to only the grantees. So it goes out, the letter goes out to the grantees, and in it includes a username and password that when you log in, you can see who your contractors and subrecipients that we have a record of. You confirm who they are. You let us know if there's any changes. So in other words, if you had a contract that ran out and you have a new contractor, let us know that you have a new contractor. Let's say you're a state DOT and you have a new subrecipient. Let us know there's a new subrecipient. Okay. Also, when you log in and on the status screen, which lists all your contractors and subrecipients, there will also be the username and password for your contractor and subrecipients. It is up to you to distribute that to them. Okay, so we don't send anything to contractors and subrecipients, only to the direct recipients, the FTA grantees. And the letter will be sent to whoever you have listed in the certifying official on your MIS from the previous year. So last year you filled out the form and put in a certifying official, that's who the letter will be addressed to, okay, or sent to their attention. If that's not a good person to send it to, they left, give us a call, send an email and say, oh, before you send the letter out, I want to send it to this person, not that person, because they've left. And we will make a change in the database and we'll send it out to the new person. So I gave you some contact information in the first couple of slides. There'll be some more contact information at the end of this presentation, and just send it to the place where I've listed. The report is due March 15th. It's due March 15th every year, and no extensions are granted. So we always get a few calls saying, oh, well, we had this issue and that issue and that issue, and we had someone leave. So can we get an extension? And the answer will be the same, no. Okay, so the method to report, which is DAMIS, as we see the damis.dot.gov, will go online January 1st, 2022 for 2021 information. So you have a good 2.5 months in which to complete the report. Shouldn't take that long, okay? So I just want to let you know, let you see how things look with FTA at this point in time. So we have the 2019 data. Those are kind of compiled data from the MIS, and 2020. And 2020 was affected by COVID, as you might think it would be. Grantees are about the same. Covered employers are about the same. Covered employees are down a bit. And it's been going up every year for a good 7, 8, 10 years. So this is the first year we've had less covered employees than we did on the previous year. Random testing, we were quite surprised. People do the random testing. They did not spread it out quite as bit as they're required to do. However, due to the limitations with the collection site, that was understandable. So down a little bit for random drug and random alcohol tests. Now the post-accident test and the reasonable suspicion test are the ones where you see really some significant drops in numbers. And that's probably due to less service being provided, which means that there's less accidents. Also, it probably had to do with the fact that collection sites were not as available during off hours. You can schedule a random test. You don't schedule a post-accident or reasonable suspicion. So I think that that's probably the reason. And it'll be interesting in 2021 if we see an increase in some of the numbers. Because like I said, generally the numbers have been increasing every year for quite a few years. Part of the reason is because there's more grantees than there used to be, and therefore there's more employers and more safety sensitive employees. So those have been going every year, and therefore there's more drug testing. But 2020 saw a decrease. So I just want to, since we talked a little bit about MIS, just want to give you some of the results that come from MIS also. So here's the random alcohol testing violation rate, 2016 to 2020. So you can see 2018 was kind of the banner year. That's one of the highest years in history. Alcohol is pretty much consistent, though. As you can see, 0.16, 0.164, 0.168. And what that's saying is that for random tests, it's about 1/6 of 1%. So it's quite a low number. Test positive or have a refusal of some sort. So the calculation is basically confirmation tests greater than 0.04 plus refusals divided by the number of alcohol screening tests. So pretty consistent. Alcohol does not jump up and down all that much. Data is kind of boring, to be quite honest with you, the alcohol testing. So just to show you that that's why it's remained at 10% as far as the random requirement. I believe it would have to reach 0.5. It's never come close to 0.5, the violation rate. So it's always been at 10%. It probably always will be at 10%. Now, the kind of the difference in that is the drug testing positive rate. So as I said before, it's going to remain at 50%. And here's the last 5 years for the positive rate. And the reason I have that red line there is that's kind of the key number. That's 1%. So when the positive rate for the nation, and this is random positive rate, goes above 1%, at that point in time, the FDA administrator has the option to raise the testing rate. So that's what happened in 2016. When 2017 was 1.06, the administrator said, okay, it's above 1%. That's what the regulation states. I have the option to change it from 25%, which it was in 2016 to 2016 and 2017, up to 50%. And so that's what happens. So it could go down to 25% again. However, it would have to go down under 1% for 2 consecutive years. And right now, 1.17, 1.16, 1.08, those are some of the highest numbers we've had in the history of the program. And I want to show that in the next slide. So this is, as you can see, the positive rates from 2007 to 2020. Now, if you go down to 2007, you see, boy, pretty consistent, 0.81, 0.82, 0.81, 0.82, 0.85. That's where it was even before 2007 for several years in a row. So all those years, it was at 25%, the required minimum testing rate. However, in 2007, it went to 150%. Now, the program started off at 50%. That's the default. It went down to 25% after just a few years of the program. So it was at 25% the majority of this program. But you can see how much it's gone up in just a few years. So 2014 or so was when you started seeing various states legalizing marijuana. And that's where you kind of also see where the numbers started going up. Okay, so we're at a point now, and I think 2020 is actually, I don't think it's so much that there was necessarily less drug use why it went down. I think COVID and the issues with collection sites and such gave people who would test positive kind of an easy out in which they could say, well, I'm not comfortable taking a test and things like that. So it was, it will be, again, very interesting to see what happens in 2021. But as you can see, it's gone up, and it's been going up for what? It's about 8 or 9 straight years now. It's been going up. So I think we're going to see that trend continue. So when I said before about the comment about marijuana, this will tell you exactly why I made that comment. So you can see back in 2011, how many, the blue line is how many THC positives there are, 2011. And so you can see where it went up until 2019. So that's more than double. So the actual number of positive test results, which there was THC detected, has more than doubled from 2011 to 2019. Now, there have been more tests done, but not nearly double. It's only gone up. It only goes up a few percent, the number of tests each and every year. But the number of positive test results has gone up significantly. So, and that's why, but you also see why marijuana drives the positive rate. At this point in time, we're somewhere in the vicinity of 75 to 80% of all positive tests have marijuana, if not more than that. So you can also see the reddish line. Cocaine was also at its highest in 2019. And also at its highest in 2019 was amphetamines. And opioids was close to being its highest. But of course, there's other reasons why opioids went up. In 2018, DOT added synthetic opiates to the testing panel. So that meant that they added things like OxyContin, hydrocodone, things like that to the testing panel. So the synthetic opiates were added. So immediately we saw opioids go way up. So as you can see, there's been a lot more detection of positive drugs in the last few years. And again, that's partially because there's been more tests, but also not nearly the rate of the positives going up has far gone past the rate of the number of tests going up. So which is why we see when we saw 0.8, 0.81, 0.84, the positive rate, we now see 1.17. So it's a significant rise. And I don't think we're going to see it going down again. 2020, I think there were some issues because it was a COVID year, and we'll see what happens in the future. So drug types, percent of positives, urban versus rural. Okay. So people, it's always interested to see, well, is there a difference? And if you look at it again, THC, 75% of all positive tests in the urban setting for urban systems is THC, and it's about 69% for rural. Not that much difference. Same thing with cocaine, a slight difference. Probably a little more significant difference. It's a more detected in urban systems than in rural systems. However, on the other end of it, opioids and amphetamines, you see that it's almost 2 to 1 as far as rural. Those are much more common in rural settings or for rural transit systems than for urban transit systems. Okay, so we see THC and cocaine seem to be more prevalent in urban settings. We see opioids and amphetamines seem to be more prevalent in the rural transit employers. So just something that I think is interesting to look at. And so for 2020, the actual number of positive drug types. So again, you see THC with 2,841. The next closest is cocaine with 454. So that's really a big difference. And you see PCP is always around 20 to 25. There's never that much PCP. Opioids has increased quite a bit in the last few years, again, due to the synthetic opiates. Amphetamines is coming in third place. So, but you can see how it's dominated. The positive tests for is dominated by THC, far and away. And if you go back 15, 20 years, it was less so than that. Cocaine actually made a much higher percentage of the positive tests. Okay. So, kind of through with the MIS and some of the testing results and some of the numbers we look at, and we're just going to look at some of the resources that FTA provides. So FTA has actually a good newsletter, and it provides you with a lot of information, whether it be upcoming trainings, whether it be interpretations or guidance, as I just said with 5310, and just issues that are coming up. A lot of the issues or the articles that we write with the newsletter has to do with things we're seeing when we're on site at audits. Not on site right now, doing them virtually, but what we find when we're on audit. So being out there and being at the employers, the transit employees, we really can detect kind of what are the issues that people don't understand, that are confusing people, that maybe sometimes we find out things that there's some bad training going on out there. So we try to address those issues in the newsletter. They're quarterly newsletters. I would really suggest that you sign up for it. If there's new tools coming out and such, those are going to be addressed in the newsletter. It's going to be, like I said, talk about training, when the national conference will be, things like that. So I would go to that website, sign up for it. There's a button there to click to sign up for it. It's not as easy to sign up the newsletter as it once did, because it's tied into the whole FTA system, whereby you can sign up for information for almost any subject matter that FTA addresses. But just scroll down a bit, you'll see drug and alcohol, sign up, click on it, put in your email address, and when a new newsletter comes out, you'll get an email. We don't spam you to death. We will send out quarterly newsletters to you, and if there's any regulatory change, and maybe some information about the national conference and some training. That's basically all we'll send to you, okay? So, but it's good to have. I've been recently going on a lot of these audits. I've noticed that people haven't signed up for it. So there's no cost. It's easy. And again, we're not going to spam you to death. One of the other tools that we have resources is the 60-minute training video. So this is something that came out several years ago, and it's been well received, and it's the easiest way to meet the requirement of 655.14, which basically says that every covered employee must receive at least 60 minutes of training on the effects and consequences of prohibited drug use. So FTA created a video. It's about 65 minutes in length. It meets this requirement. If, as auditors, we come in and say, okay, how do you do your 60-minute training on the effects and consequences of drug use? You can say, we watched the FTA video. Just document the fact that when each individual watched it, and just say, what the time, date was, and that they did complete watching the video and such. And that will be fine. That will suffice. Another tool that's available to anyone out there that we've got a lot of good remarks about is the policy builder. So in other words, everyone needs to have an FTA drug and alcohol policy. Every covered employer does. Okay, so FTA put in a piece of software that will write the policy for you. So click on this link and go onto the FTA website, click on the link there, and it will ask you something like 7 or 8 questions. After it asks you those 7 or 8 questions, it will create a policy. It's a compliant policy. It's a very minimal, meets the requirements policy. If that's your policy, when we come on site or do a virtual audit, then we will say, great, you have a compliant policy. And we won't need to have any policy findings or review the policy as long as you don't change it. It is created in a Word file, which does allow you to add things to it if you wish to add some things that are company authority, or you wish to put in names of the DAPM or make it look like yours by putting in letterhead and all that type of thing. You can do that. The thing is, once you start changing it, remember, you could be changing it from a compliant policy to a non-compliant policy. However, we will still review it. It's still a very good tool. It's a very good tool to start with when creating a policy. And again, it will have all the required elements in it. A short 7-8 page policy. Easily understandable, easy for your employees to read and say, okay, here's what I can expect. Okay. Easy for your DAPM to look at and say, okay, I don't remember how we handle negative dilutes. So that'll be one of the questions. How are you going to handle negative dilutes? Are you going to retest? Are you going to accept a negative test result? So if a situation comes up, because those don't come up very often, you can just pick up the policy. And since it's an 8-page policy, you can read it easily and find what your policy is. Okay. Some of the other program components that you'll find on the website, trainings and conferences, there's website, but there's a couple of things coming up. We're going to be at the CTAA in Richmond, Virginia. We have not yet received the booth number, but we'll be there at the trade fair in a booth. Come on by, ask questions. We'll have some materials such as post-accident cards and reasonable suspicion cards and some forms and some newsletters and other things that you can, if you don't have enough stuff to carry around at CTAA, you can pick up, but also ask any questions. So the FTA will have a booth there. Again, don't know the booth number at this point in time. We get a lot of questions concerning the annual FTA Drug and Alcohol Program National Conference. Last one was virtual. We've been told by FTA that this one will be virtual also, that they are not going to have sponsor a meeting where there would be 600 people. So the date is to be determined. However, I would assume that it's going to be like last year, sometime in May, and we will make that determination fairly soon because we kind of have to get started on it. So I would assume in May. If not in May, I don't expect it to be in the summer. I would expect it to then be in September or October at that point in time. But I'm thinking May. And last year we had virtual, and we had 1,800 people who registered and who logged on and such. So we'll probably do it in the same fashion if you did see last year. But there'll be 4 days with various sessions going through the 4 days, post-accident, MIS, how to do a policy, how to prepare for an audit, what you expect from your substance abuse professional, things like that. So, and if you have any suggestions for other presentations, then email them to me, and if we can agree on it, it sounds good, then we'll do a presentation. If you think there's something necessary, we've in the past done how to specific training sessions about rural versus urban and things like that. Also, another thing that's happening is we got some virtual trainings coming up. So 10/26 FDA drug and alcohol regulatory updates and requirements. So that's a 3-hour training. We're basically going to go over all the requirements in an FDA program. It's difficult to do in 3 hours, but we move through it quickly and go from policy to MIS to you need to have a testing program to you need to have training, 60 minutes for drug consequences, an hour and 20 minutes for reasonable suspicion training of company officials. We go through what are the requirements of a random program, what are the thresholds for post-accident testing and such. So that's happening 10/26, and then on 12/14 and March 1st, we're gonna have a session on how to complete your MIS. It's a 90-minute session. We'll actually fill out an MIS in those sessions and kind of show you how to move through the form and such. And if you have a suggestion for any other types of training, please again email them to me and let me know what you have training for. Or if you'd like to, let's say you're looking to have a state training, or you want to have, you want to volunteer to host a training. Typically we'd be on site, but currently we're doing virtual. But if you want to have kind of just a special group where you only want to have individuals from your state, then fine, we can do that. We probably will be doing other 3-hour trainings coming up, and we'll be scheduling them shortly. So here's some of the other help information that I said that I was going to provide to you. So there's Ion Rosario, the FDA's program manager, and there's her phone number and email address, and you can call her or send her an email if you wish to. And then there's the project office, which is at the Volpe Center. There's a hotline, which we always include in the MIS notification letters we send out. And the 4 individuals under those will basically be the person who picks up the hotline number 2. But there's also the individual numbers. Jennifer Gissel, Laurie DeCoste, Felicity Shanahan, and myself. We are also the federal representatives on basically 95% of all FDA drug and alcohol audits. The way it works is the audits have a federal rep and then typically 3 to 5 contractors on an audit. And the 4 of us are typically the federal representatives on those audits. So there's our email numbers and contact information. If you have questions, give a call, send an email. At any point in time, we do our best to get back to you as soon as possible. And then if you have any questions, I'm here. I'm not sure if how to go about doing this, but I'm here and willing to take questions. And I know
yeah, I'm not sure how the best way to do this would be, but does anyone have questions I can try to relay? Oh, yes. Sure, yeah, come up if that's easier.
In reviewing my third quarter testing, I have noticed that there's a gap in time frame from when the specimen is being collected, the urine specimen is being collected at the site, until it is processed at the diagnostic center of about 20 days.
Wow.
Is that a problem? Is that a concern? Is the specimen still good? after 20
Sure.
days?
Well, I mean, the specimen's still good, most likely. I mean, you don't know what's happening to it along the way. I mean, we've had situations where for mobile collectors, someone has collected a specimen and kept it in their car for like a week. And in the heat, yeah, you can have degradation of the specimen. That is concern. I would check with the collection site and make sure they're actually sending out the specimens within 24 hours because they are required to do that. Typically, the laboratories will turn the specimens around very quickly. The delay at the lab is rare. It's usually in that case like that, the delay at the collection site. So I would make sure they're actually sending those out in a minimum of within 24 hours. That's the requirement.
Thank you.
You're welcome.
If there's no other questions, I think we can wrap it up.
All right. 4 minutes early. Pretty good.
Thank you, Michael.
All right. And again, if anyone has any questions, you have my email, phone number, give a call, send an email. But thanks very much.